4:30, a viral trend could be putting people with diabetes at risk. Ozempic is a popular drug that's supposed to treat diabetes, but some are now using it to lose weight, which is causing problems for patients who actually need it. Dr. Devika Umashanker from Hartford Healthcare is joining us live right now to talk more about this. Doctor, good to see you. Thank you for being here.
Thank you for having me.
So I'm assuming here this Ozempic is being used in an incorrect way, right? That could potentially damage the patients who need it and don't have access to it, but also the patients who are using it for something they shouldn't be using it for.
Yeah, so Ozempic is the FDA-approved type 2 diabetic medication that's being commonly now used as an off-label approach for weight loss. And what we've seen is that it is now in a place of shortage where it's impacting the care of our patients with diabetes who need the medication. And this really comes out of Wegovy, which was the FDA-approved weight loss medication that is the same as semaglutide, just used at a higher dosage for weight loss.
So in other words, and correct me if I'm wrong here, but the real medication for weight loss, there's a shortage of that right now, but if you kind of increase the dosage of Ozempic, it'll kind of do the same thing?
So similarly, so it's the same exact medication, except Wegovy is dosed higher at 2.4, and Ozempic goes up to 2 milligrams.
I see.
So patients can use the same medication to a certain point and get that weight loss effect. And now, as clinicians, we're seeing how it's affecting our care that we're providing for patients who have type 2 diabetes.
Right. Well, I was just going to ask you, so obviously this is very bad because people really rely on the medication. What does it do to help patients who have type 2 diabetes, those who really need it?
So specifically, it helps with control of their blood sugars. And so not having this medication, the good thing is that we do have other medications we could utilize, but the Ozempic is one that's, shows greater improvement in their glycemic or sugar control. And we want to make sure that we have this medication for patients that are being FDA approved for type 2 diabetes treatment.
Is this a matter of people getting their hands on a prescription and using it in a way that they shouldn't? Why are they getting prescriptions for this medication when it's not the proper way to use it?
Yeah, I think as physicians, when we see patients who are at pre-diabetes, at the cusp of becoming diabetic, and we see that they have weight management challenges, it's being used as an off-label approach. And it kind of strikes that ethical question of, do we use it in patients who don't have type 2 diabetes? And I think that's where, as clinicians, we have to make that individualized decision on what's best for our patient population. But seeing now that Ozempic is being at a shortage, I think as, providers, we just have to make, appropriate decisions to use it in the correct manner for what it's been approved for.
And I would imagine if anyone has any concerns, especially a patient with diabetes, they should definitely reach out to their doctor.
Absolutely, absolutely. Providers, all doctors, physicians, to at least get a medication in the same family that can help with your sugar control.
All right, Dr. Devika Umashanker, thank you so much for joining us this afternoon. We appreciate your time.
Thank you so much.